Hi, my name is Megan Klatt. I'm an infectious diseases and antimicrobial stewardship clinical pharmacist at the University of Kansas Health System in Kansas City, Kansas.
And hi, everyone. I'm Ryan Moenster. I'm a professor of pharmacy practice at St. Louis College of Pharmacy and an infectious diseases clinical pharmacist at the VA St. Louis healthcare system.
So the three major pieces of ID guidelines that were updated or released this past year, the first being our complicated UTI guidelines. Everybody is pretty familiar with these guidelines at this point, but they were, kind of solidifying our current practice as to how we define an uncomplicated versus a complicated UTI. A lot of emphasis on oral antibiotics and shorter courses, which we all love as stewards, which is great. The other two guidelines are a little bit controversial. CAP, we had updated guidelines from the American Thoracic Society that the IDSA chose to not support. And so there's been some back and forth as to why that is, mainly due to the recommendations on prescribing antibiotics in the setting of a positive respiratory viral test. And then, of course, we have our Surviving Sepsis Campaign guidelines, which were also very controversial. A lot of different recommendations there, but the one that resulted in the most amount of discussion is the routine pre-hospital antibiotics in patients. And so there'll be a good amount of discussion as to how to implement that moving forward.
I'll talk a little bit about the new drugs we're going to cover too in this session. Now, there are really only two products we're going to cover. One is a completely new drug that's called zoliflodacin, and the other one is gepotidacin, which was actually approved back in earlier 2025 for urinary tract infections. But what's interesting about both of these drugs is they're approved now for treatment for Neisseria gonorrhea infection, an area that we have increasingly few treatment options. And so this does help expand options for providers to use. So we'll cover both of those in the session. And then I'm going to take a little bit of time to cover some of the more impactful studies, I guess, at least that we have time to cover, that were just very recently presented at the ESCMID 2026 meeting to kind of give folks an inkling into some of the late breakers and the oral abstracts that were presented at the meeting. So some really interesting studies there. One of the larger ones we're going to cover is the Peter Penn trial, evaluating some gram-negative resistance. And then we're also going to talk about everybody's favorite, probably everybody's favorite, talking a little bit about Staph aureus bacteremia. And then we get into sort of, I think, our bigger section is talking about some primary literature. And the quick two studies that I'm covering for that are going to be the Game Changer trial, which came out back in November, was published in Lancet ID. I think that was kind of a favorite of everybody. I've had at least two of my students do journal clubs on it. We're going to cover that. And then we're also going to cover another Staph aureus trial, the Cloceba trial, evaluating cefazolin versus anti-staphylococcal penicillin. It's another kind of oldie but goodie with a little bit of a spin on it.
That's great. And then I'll end our randomized controlled trial section with talking about the DOTS trial, which has already gotten a lot of conversation here at MedID SADP annual meeting, and then the TAPER-V study, which was looking at vancomycin for the prevention of CDI and treatment of CDI. And then we'll kind of shift focus to some of our antimicrobial stewardship related trials. There's a bunch of those, so won't highlight every single one, but some information about UTIs, which was very popular this year, some data on short courses for enterococcal bacteremia, oral antibiotics for endocarditis, etc. And then we end with a really rapid fire session going over some other key and important ID-related topics. And then that's the end of our about 90-minute session.
Don't forget to like and subscribe so you can catch everything from Infectious Disease Special Edition.